just me, or does it just not feel like a day where they're going to come in here? Like, I don't know. For some reason, I'm like, yeah, you know, they're not coming. What'd you say?
I like almost forgot I had autofocus on still, so I'm on 4.
You made it.
I did, I was on the other side of town. How are you guys?
Fine. You?
Not too bad.
Where were you at?
Elliot.
Oh, for the Park District
Yeah.
site? Yeah. Sorry. I use a transcription thing for my live shots. I think so. It's just. Could you. What was that? Thank you.
Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and today I'm joined by Major Mark Motzoff of the Salvation Army of the Rockford chapter. So talking a little bit about, as you got all the excitement out, vaccination plan has been submitted to the state of Illinois. We're waiting to hear back on any of the areas they feel that we need to adjust. And of course, the state has made some adjustments as we've gone through already, so we know we'll be making some changes. But I want to remind the public of some general principles because I know there's already excitement and anticipation and interest in the vaccine. The 50 counties with the highest death rate will be given the first round of vaccine. Winnebago County, unfortunately, is one of those counties. Local health departments are responsible for the oversight of the initial allocations. And we expect that the Pfizer product will be the first to receive approval from the FDA under the emergency use authorization tomorrow. So tomorrow is the hearing with the FDA. Some other kind of principles about this is that first group will be dedicated toward healthcare providers and residents of long-term care facilities. We need the public to understand, please be patient. There's no waiting list or appointment list or other populations at this time. Please don't call your healthcare provider or the health department, ask to be moved up in the priority list. Everyone who needs a vaccine will be able to get a vaccine, but it won't be in the next month or two. And vaccination will be voluntary, and it requires that special consent under an emergency authorization use. The vaccine will require 2 injections, 21 days apart. So it'll be very important for us to monitor and track what type of vaccine was administered the first time and 21 days after that. So we are working very closely with our hospital partners in the Rockford area to be able to take in this vaccine and be able to distribute it to their employees in a short period of time. And the employees that are prioritized are those healthcare workers in direct contact providing frontline work to individuals with COVID. So what can we do while we wait in hope and anticipation and positive spirit? We still need to support the social mitigation measures. We need to continue to mask. We need to continue to social distance. We need to do our frequent hand washing. We need to think and be thoughtful about limiting our contacts outside of our household. It is having an impact. The other news that I want to share with you is about testing. The community-based testing site at Rockton Avenue, operated by the Crusader Community Health Center, will be closed effective Friday, December 11th at 4 p.m. That will be their last day. We appreciate their assistance in helping to make testing available in our community. They stood up testing with the health department at the start of this pandemic before the state brought in their testing. But they also recognize that they need to return to their primary core functions in business. They need to begin to care and plan for individuals to vaccinate within their patient-enrolled populations. They need to be able to prevent hospitalization, so they are working hard to transition back to their clinic settings and their primary care. They will continue to provide testing to their enrolled patient populations as they have throughout this pandemic. And the site at the University of Illinois Health Sciences campus, run by the state, will expand its capacity to be able to accommodate all of the patients that were normally tested through the Rockton Avenue site. The good news is that this site at the University of Illinois now has a web application that will help you pre-register and get your results directly into your phone. I know we've all been waiting for something much more automated rather than waiting for paper results, calling the health department, calling the state. So we want you to please visit Test Directly, that's TESTDIRECTLY.com to pre-register for your testing at that site. They will take you if you do not pre-register, but it will make the process go much quicker if you pre-register. We also are thankful to Total Faith Community Church, located on 1250 South Perryville Road, who will be hosting a pop-up testing this Saturday from 8 a.m. to 4 p.m. Again, no ID or insurance is required. No citizenship questions will be asked. It's a nasal swab test, and it's for individuals ages 2 years and up. So again, we appreciate as Crusader begins to transition back to their home base to give care to their community. We are appreciative of those other organizations that are standing up to help us provide some additional testing capacity. Last week, we also learned that the CDC provided some additional qualifications on quarantining. It is still recommended that you continue to quarantine for 14 days post-exposure. That is the gold standard. It is up to local health authorities to determine the timeframes of quarantine based on the metrics, community transmission, and hospital capacity. With our positivity rate and case count, Winnebago County will continue to follow the best practice of a 14-day quarantine post-exposure. And the reason and rationale for that is getting out of quarantine does pose some risk for asymptomatic transmission. And we are working very hard as a community and a population to keep our transmission low. And again, we need to do our part to minimize the spread as much as possible to support our businesses reopening and our community. I think the other focus we want to kind of talk about, we've talked about testing, we've talked about the vaccine, is now to really focus on the human touch. And so that's why we've asked today the representatives from the Salvation Army and our Winnebago County Coordinator, Major Mark Martzoff, to give some context of all the work that they've been doing throughout this pandemic to support our families in need. So with that, Major Mark.
Well, on behalf of the Salvation Army, I would like to express my deep appreciation to Dr. Martell and to the Winnebago County Health Department for their efforts to combat this COVID-19 pandemic. I would also like to thank our dedicated health professionals who every day for the past 8 months have tirelessly worked day in and day out to care for those who have been affected by this deadly virus. You are truly hometown heroes. Thank you for your efforts. I also want to thank our first responders who put themselves every day in harm's way and in the path of this virus to serve and protect our community. It has truly been an honor for the Salvation Army to assist these brave men and women in their efforts to fight this disease in our community. We are grateful for the opportunity to come alongside and help where we can to ease the pain and suffering of so many in our community. The Salvation Army has been serving the Rockford area for 133 years. In 1918, the Salvation Army rolled up our sleeves and went to work alongside so many dedicated people then as well during the great Spanish flu pandemic that hit our community so hard. For these many years, we have sought to help our fellow citizens in time of crisis and in time of great need, whether serving in a pandemic or the Great Depression or during economic downturn. At various times in our history, we have sought to serve suffering humanity in the name of Christ without discrimination. Whether it's been food for the hungry, coats for the shivering, or toys for children at Christmas time who otherwise might not have a Christmas. But one thing for certain, none of this great history of service would be possible without the support and generosity of you, the caring public. Whenever there's been a call for toys, a call for food, a call for coats, a call for much needed funds, the hard-working people of this community always seem to dig deep and help their neighbors in need. This year, with the COVID-19 pandemic, we have seen a dramatic increase in the need for services. Last year at this time, the Salvation Army had assisted about 4,600 households. This year, during the 8 months of COVID, we've assisted over 26,000 households, which represents an over 500% increase. For many of those households, it's the first time they have ever had to access emergency services and ask for help. It's been a very traumatic experience for many of them, and we've trained our staff and taught our staff to please put these families at ease and let them know that it's okay. And at some point, when this is all over, you'll be in a position where you can give back and you can help other people. We've seen the generosity of this community in so many ways. There's still much that needs to be done in order to help meet that need. Many more dollars need to be raised to offset the costs we are incurring. And I would encourage you this Christmas season, when you go buy a Salvation Army red kettle, please put some money in. It's always appreciated and much needed. Or you can use your cell phone and the QR code or the Google Pay or Apple Pay to make a contribution. Or you can donate online at salarmyrockford.org. I want to tell you that you are making a difference. You are touching people. You're helping to feed the hungry. You're helping to care for the disadvantaged. And you are making a difference. We're so grateful that we can partner with Winnebago County and the Winnebago County Health and all of our other partners in this endeavor to meet needs, and we'll continue to do so. And I'm certain that when all this is said and done, we will be a stronger community because we've cared for our neighbors. Thank you, Dr. Martell, and thank you all. May the Lord bless each one of you, and Merry Christmas to everyone.
Thank you, Major Mark Martzoff. As we know, this pandemic has impacted us in so many ways, and we would not be able to stand up a response without the support of an organization like Salvation Army, and clearly the history. They've seen it before. So as we come through today, the new numbers to report, we're reporting 121 new cases. Our total case count is 20,043. The new cases represent everyone from 2 months to 100 years. And once again, we're reporting additional deaths. We lost 4 residents of our community to this pandemic. And our total death rate now is at 296. We mourn every single one of our residents that we have lost. The test positivity rate is 15%, and our regional positivity rate is 14.6%. So all of the mitigations that have been in place, and yes, they haven't been perfectly followed, are having an impact. And our hospitals have been reporting that they are also seeing some improvement in their situation. And again, when we talk about this, it's not just about new infections, hospitalization, but also at the end of this, we want to have everyone ready for vaccination. We want to get to the finish line, right? We want everyone around to do this. And our recovery rate is at 98%. But we have to continue to work to keep that recovery rate high and our hospitalizations low. We're reporting 2 new locations of concern: Prairie View Assisted Living and the Winnebago County Juvenile Justice Center. So with that, I'm happy to take any questions.
Dr. Martell, some businesses, they have up to 7 orders of closure, and then others appear to only have 1, but they've both been kind of defying that order the same. Why might that be?
So the question is, some have gotten the 7, what we call 48-hour closure, so an incubation period, and the next step is to suspend their food permit, so they are clearly operating in violation if their food permit has been suspended. So they're not only violating the executive order, they're violating county ordinance. Then you have the group that are still in the enforcement process. So they've been issued a closure order and have not followed through. I will also tell you that some close and open and close and open. And yes, we do inspect all of them. But I come back to, we're not tricking the virus here, folks. We've said it before. It's a very fragile situation that we're in right now. We just came through the Thanksgiving holiday. We're really almost at the 2-week mark now. And our cases have been relatively stable. Our hospitals have been able to maintain throughout this. But it's fragile. And so repeated openings, keeping those, get people going out, getting exposed, will not support the system overall. And we're facing a very rough winter, as we've heard nationally. And of course, I think we're facing some of the most difficult times, which becomes important about how do you look outside yourself. It's not going to be a holiday like you've known it before. We're going to have to, we talked about child trauma last time. We're talking about the needs of so many of our families to get through this system and thinking outside of ourselves. And the reason that we're doing this is to protect our entire community. So again, we will go out, we enforce, we post, we refer to the state's attorney. Our newly elected state's attorney is reviewing all of the options available to them on the legal process. But we are following the process that we intended to and will continue to follow that.
Kind of just following up, businesses seem to get these closure orders based off of complaints. How are you guys monitoring those complaints and phone calls to make sure it might not be the same person continuously complaining about the same place, or what's the system in place there?
Well, first of all, we validate every complaint. The question was, I'm still not trainable yet at this point to repeat the questions. But first of all, we take every complaint, and obviously we look at the source. So if my name and address comes up as, we're not going to divulge who that is because we protect their confidentiality. But if I repeatedly complain about the same institution, the challenges for us is we go out and we validate it. So our inspectors go out. And I know they all know us as inspectors now. It's kind of almost, humorous to recognize that they know who everybody is. We don't wear anything special. But you kind of pull up and I hear, oh, it's the health department. So again, we're not a big staff and we're not a big community. So people are known. And so we will go out, inspect, we validate the complaints, because again, if someone is trying to, disrupt a business intentionally and they are spreading incorrect information, we're not going to cite a business that is truly compliant and doing what they need to do.
Dr. Martell, turning over to hospitalizations, and maybe you had mentioned that they are improving from what the hospitals are saying. Can you talk a little bit more about those numbers as far as capacity? I think a lot of people are still wondering about that, knowing that the positivity rate is going down, but it's still steady. What's the update with capacity for hospitals?
So, the challenge is, the question is about capacity in hospitals, and we look on the site, and, initially, everyone thought things were well, because we talked about the concept of licensed beds versus staffed beds. And so not only did we run out of beds in Winnebago County, right? Staffing was already kind of, critical. So we had to order additional beds that were placed in areas where typically hospitals were not using. And right now, they are able to maintain at the current level. They haven't had to get more. They've been able to kind of move back into, maybe shut some of those beds down. But it's very fragile and tenuous. So when we're reporting numbers, and we've kind of talked a little bit of last week, 200, 100, if you think that 6% or more maybe require hospitalization, each day you're adding some additional potential cases to that list. And so that's what our role is for those of us who can, is to keep our contacts minimal, wear our face coverings, avoid exposures, and stay home when we're sick, and test as we need to test.
Dr. Martell, you talk a lot about the vaccine. I think everyone's talking a lot about the vaccine right now. What are the realistic expectations you want to set to the county as a whole? Maybe not those frontline workers, but people that are looking to get that vaccine in the near future.
So what are the expectations for the public? And I think we were kind of clear up front, is to be patient right now. I know everyone is excited, right? We can actually start to see light at the end of the tunnel, but it's going to take a while to get up to that light or that exit, right? So it's going to take a while to get our most vulnerables vaccinated. We know that these vaccines, these two first coming out, are a little more fragile than our typical vaccines, like a flu vaccine. They have to be stored at certain temperatures. That's why the hospitals are the first ones to roll out, because it's called super cold chain. It can't be out for very long. You got to get it rolling very quickly. And the other part is, we've got to get all of our systems in place. So all of our healthcare providers, we're working throughout the system to get them enrolled. So places like Crusader Community Health will be able to vaccinate their enrolled patient populations. If it's, when we look at some of our other areas, the hospital being able to vaccinate patients, our long-term care facilities have partnered up with the pharmacy chains of Walgreens and CVS through the Centers for Medicaid and Medicare to provide vaccinations within those settings. Everyone that needs a vaccine will be able to get a vaccine. But the timeline will not be tomorrow. It will not be like opening a present on December 25th or on New Year's Day. It's going to be a longer period of time. But we want the public to know that we are committed to ensuring that everyone who chooses to be vaccinated will have the opportunity to be vaccinated in the appropriate phase.
Dr. Martell, when thinking about the healthcare workers are going to be the first vulnerable, we obviously have all that breakdown of who qualifies for that first time rollout. There are going to be hospital systems in certain counties that are behind that. What did you want to say to maybe healthcare workers who are in that population of not getting it right away because it's going to other counties right away? What did you want to say about that if they're getting a little antsy of when it rolls out?
So the question is, you heard the first 50 counties with the highest death rates got to be on the first phase list, a dubious distinction. I want to be clear about that. Is that one, again, we're looking at how do we get that as into the group that's caring for our most vulnerable populations and who then themselves are most vulnerable. So in that case scenario, we talk about the healthcare and direct care responsibilities. And then it will roll very quickly after that. Part of the state plan is to get it then to other counties as well. And when we say we're going to do counties within this, so if you're a worker in one of our healthcare institutions in Winnebago County, so one of our 3 health system partners, whether it's Mercy or OSF or Swedes, we're not looking at where you live. We're going to vaccinate you based on your role and responsibility. So we are not going to say, oh, no, it's only for Winnebago County residents. It is for the health system. And our health systems have made that commitment to work with us to ensure that their most vulnerable staff that are working, whether it's respiratory therapy, whether it's the nurses and that staff, and they have a very difficult task as well, tiering that so that they can make sure that the caregivers who are in the front lines are the first in line to receive the vaccine.
I know you said the vaccine is optional for everyone who wants it. Do you anticipate some type of campaign encouraging people to get vaccinated?
So the question is, while it's optional, do we expect to anticipate having a campaign? Absolutely. I think there's a lot of, we've all seen the chatter on this vaccine, concerns about its, whether it's the fastest warp speed out the door, the new technology surrounding this vaccine, whether it's safe and effective. All of those will become important information, and we'll hear more, obviously, when they present their data to the FDA tomorrow about that. And again, we will learn more. We're constantly evolving as part of a pandemic, so we know there are other vaccine types coming behind that. So we've heard about the Oxford and the AstraZeneca, we've heard about Johnson & Johnson. So many companies have been working very hard, and I liken it back, not so much to the Spanish flu, but think about the polio and the rush, I'm going to say the work of multiple scientists across the country, the nation, the world, to come up with a polio vaccine. And they came out with 2 different types, right? And they began that process. And so it wasn't all overnight that everyone could safely, know they were protected against polio. We also have to try and get enough individuals to choose to be vaccinated, right? Part of this first phase is we also know that when you get vaccinated, you've heard some of the stories coming out of the UK, the ability to report any side effects, right? Important to understand, as we bring this out to larger populations. What does that mean? No product yet has been licensed for children under the age of 18, so we're going to have to be watching all of that information as it evolves.
You had mentioned the 2 locations of concern that are added as
Mhm.
Prairie View and the juvenile. Do you know how many cases were reported at the juvenile center?
That comes out in our weekly report. I believe it's reported out in outbreak numbers as well, in terms of that area. But at this time, they are able to maintain the really, again, once the case is identified in those communities, and remember, 1 case for them gets it, is that we then isolate them quickly and so that it does not transmit or spread within that setting or location.
You talked a little bit about the closure of the Rockton Avenue campus. You said that that's to get, health personnel back into their normal working environment. With so many test numbers seeming to skyrocket statewide, is the timing right? What was the rationale there? How did that discussion progress to we can close this one down?
Well, first of all, the question is, how did that discussion? Well, first of all, they had to look and see what their patient backup volume was needed. And I think we're learning more about some of the treatments that can be administered outpatient for COVID, as well as they've got to be able to vaccinate their own patient enrolled populations with the risk factors and conditions that put those patients at highest risk. So they need to start returning back to their core business functions. Part of the role of federally qualified health centers, whether it's UI Health, Crusader Community Health, or Aunt Martha's, is really to treat patients outside of the hospital environment to prevent those complications that require them to need hospitalizations. You've heard our hospitals talk about not only just is it the COVID, caring for the COVID, but the severity of the illness that people are presenting with. So really, this became an opportune time to begin to push back. We have more of the Binax testing, the antigen testing that's being done, some of the more rapid testing, and really the ability to expand capacity at the other location, right? So when the sites first started opening up, both sites could only test under 500 a day, right? We talked about that earlier, and we thought that was, and the new site really in the expansion at that site, they will be able to have the capacity of 10,000 tests per day. So they anticipate being able to care for everyone that needed a test at Rockton Avenue to come over to the UI site. Now, the other good news on that is that's a 7-day-a-week test site. And the only day that we've heard right now that they're not planning to be open is January 1st, and I'm going to guess December 25th will be the other one. But I don't know why they gave me the January 1st only. But again, the idea being that they also had that 7-day-a-week capacity. And I think that this really becomes, as we move through the pandemic, it's constantly evolving. The testing capability and capacity at different sites. Before, remember, the only places you could get a test was at one of our drive-thrus at a hospital. Now that you can get them through your doctor's offices, some of the wellness centers, are able to provide those more rapid tests, be able to work with patients then to prevent hospitalization and complication.
Dr. Martell, we know that nursing homes and long-term living facilities are at higher risk of having more cases there. We understand that there are many, many places that do have those cases. However, there are some that have a higher death rate than others? Are there causes to that as far as a certain living facilities may have a higher death rate because of certain mitigations that might not be, are there causes to that?
So the question is, when we look at long-term care facilities overall, there's increased risk, but why do some appear to have more risk than others? And it could be a combination of factors. And I often come back to, when we come through this, when you look even statewide, what is the community transmission rate? We've talked about they work very hard to keep the infection out of those locations. But as the community transmission rate, whether you're a school or you're a long-term care facility, those numbers start to come up. It's very hard to keep it from coming in. And then overall, depending upon what kind of care you're providing, if you're at end-of-life care, if you're doing more of that kind of care, you would expect some of that to be a little more challenging and fragile in those situations. But I really want to be clear that if you look statewide overall, there are very high rates of infection in those. And again, partly because our community infection rates are high. We have to understand that we've got to protect that vulnerable population.
For the death rate, I guess, was there, because like you had said, if the community rate is overall high, that in turn leaves that facility at a higher risk. So that is normally just kind of looking at it community-wide, the higher that is, the more chances for their death rate to go up as well?
That is correct. The chance is the community infection rate increases. And throughout this pandemic, and we don't put a lot of charts and graphs up, but if you start, first of all, as cases rise, then subsequently you have the hospitalization rise, and then subsequently after that, you have the rise in deaths. And, when you think about, we're getting better at caring for people in the inpatient environment, but you have to have a certain reserve to be able to be cared for in an inpatient environment. So, for instance, if you come in at a certain health level and you're able to then fight off and then able to provide you treatment and provide you with rehabilitation services, you can exit out. It's much more challenging when you get in the extremes of life.
Question for the major.
Yes.
You said you have assisted 26,000 people so far this year. Assisted in what way?
26,000 households with food, rental and utility assistance, coats, clothing, many of those services that we provide on a regular basis, but we've seen them dramatically increase this year based on the need.
Are these people who lost jobs or lost it?
Many of them are people who have been on unemployment and have lost their employment.
And I also want to add that initially, they were one of the areas that helped us pass out masks when masking became a requirement in the community. We were out there as part of our communities of concern, distributing masking kits from our community volunteers as well, because again, they had access to a population that may not have been able to go out initially and purchase, that we wanted to make sure that they were protected as well. All right, again, thank you. I want to thank the Salvation Army again for their commitment to the community throughout this pandemic. And I want you all to have a good week. Stay safe, mask up, make sure you've gotten your flu vaccination. We are seeing light at the end of the tunnel.
Thank you very much.
Thank you all for being here.
Okay, not a problem.